One of the most common things that we see in the clinic, which also correlates with one of the most common causes of vertigo in the adult population, is BPPV, which stands for benign paroxysmal positional vertigo. This means that it is not really a very harmful condition, even though it makes you feel terrible, that comes on suddenly with certain positions of the head, and it gives you a sensation of spinning or rotating, either yourself or the room around you, that can last for seconds to minutes at a time, and then it starts to go away. BPPV is caused by a peripheral vestibular dysfunction, meaning that there is a problem in the vestibular system, which is located in your inner ear. Looking at the anatomy of the inner ear, we start with the outside of the ear, which is the part that we see on the side of our head, followed by the ear canal, which leads to the eardrum, which is part of our middle ear. Behind the eardrum sits the inner ear, which is composed of the cochlea, or the spiral portion, and then this portion up here, which is actually your vestibular system. The vestibular system itself is comprised of the center portion called the vestibule. Inside the vestibule are little hair cells that have calcium carbonate crystals sitting on them. Those crystals shift over hair cells to trigger a nerve to tell your brain about vertical and horizontal movement. The other portion of the inner ear's vestibular system are these loops called semicircular canals. Each ear has 3 loops, and they're oriented perpendicular to each other, and they're full of fluid. When you rotate and pitch your head, the fluid inside these canals swishes around and triggers a nerve to tell your brain about rotational movement of the head. In BPPV, what happens is that the calcium carbonate crystals that are supposed to be in the center portion of the inner ear's vestibular system, in the vestibule, for some reason become dislodged. And when they become dislodged, they can sometimes fall into one of the 3 semicircular canals inside the vestibular system. When that happens, when you move your head or into a certain position, such as rolling over in bed or bending down to tie your shoes, not only does that fluid swish around through the canal, but it also causes those little crystals to fall through the canal as well. That continues to put pressure on this nerve receptor here that continues to send a signal to your brain that you're spinning or rotating even though you're actually staying still. When I see a patient in the clinic who I think has positional vertigo, there's a series of tests that we can do that will look at each specific canal within the vestibular system. That allows me to figure out exactly which canal is affected by the positional vertigo. Treatment afterwards is relatively pretty simple, even though it doesn't make you feel so good necessarily. But what we do is a series of canalith repositioning maneuvers, and you've probably heard of something called the Epley maneuver before, which is one of the techniques available to us. But we use these repositioning maneuvers to get those crystals to loop back through the semicircular canal into the vestibule of the inner ear. Once they're in there, the body will either break them down or they will reattach to the little hair cells in the vestibule where they are supposed to live. Typically, with BPPV, for as awful as it makes you feel, we can get complete resolution of symptoms in 1 to 2 treatment sessions. If you think you have positional vertigo, which is such a common cause of dizziness in the adult population, give us a call or feel free to ask any questions anytime.